Oops. Anyways, so yeah, this is just a presentation, and if you guys have any questions or anything at the end, feel free to ask. Um, so I don't know if you're sharing the slides or not, Susanna.
Yeah, I can show them.
Yeah, thank you. I appreciate it. Just a little bit more like background on me. I wasn't the greatest of students. I had like a 3.3 GPA overall. I had an MCAT score of a 506, which is all right. Nothing crazy. But the one thing that I was really strong at was my letters of rec and my extracurriculars, which is what I kind of focused on during medical school. Undergraduate school. I really wanted to emphasize my networking and meeting doctors and other people that could, vouch for me when I do send my applications or when I did send my applications. And I also wanted to emphasize that I really cared about my community, and I kind of showed that within my resume. I worked as an EMT for a year, so I got a lot of experience just being like an attending on somebody, doing a physical exam, getting a history, um, working as with the team with paramedics, presenting my patient to the doctors in the ER or the nurse in the ER. So a lot of stuff you do in med school, I got to do as an EMT. But it was a very stressful time because I was in school and I was working 12-hour shifts minimum as an EMT. So I had to leave that job, and then I started working with kids with ADHD and autism at a behavioral clinic, which was a completely different experience. But that was nice because, first of all, I like working with kids. And then second of all, I got to work in the clinical setting, which was, again, completely different from working inside of an ambulance and the emergency department. So I did that for a year, and this was during my last year at Irvine. And then between 20, I guess the end of 2018 till my acceptance in medical school, I worked as a medical assistant at a doctor's office. So, which was another completely different experience than the behavioral clinic I was at. So, while doing all this, I kind of also did a bunch of different volunteering stuff within my community, which is I'm from Pasadena, so I did a bunch of things with like Azadamar Scouts and all these Homeland Men and AYF stuff. I just did a bunch of that type of stuff to volunteer and get some things on my resume. So yeah, and let's go to the next slide. So yeah, I kind of went over all the stuff. So my advice for you is yes, you need to do well on your MCAT, and yes, you want to finish with a strong GPA because it just will make your life a lot easier, a lot less stress. But do not forget about the extracurriculars such as research, um, getting volunteering experience, or working within uh, the medical field any way you can, even if it's scribing, if it's being an MA, if it's um, whatever. It's really important, and I could definitely vouch and say that's probably why I was interviewed, is because my resume was a lot beefier than a lot of other people's. I got a chat. I think. Oh, I think I missed your role at the behavioral clinic. Oh, at the behavioral clinic, I was they had like a weird term for it. It's called a neurophysical therapist, and all I did was essentially the objective of the clinic was like a biofeedback type of clinic. So we would attach EEGs to the patient, and they would kind of play a game on the computer, and it helped with their focus and concentration, and as well as promote like optimal brainwave functioning. It was a little odd for sure. I didn't know what I was getting into, and I got the job through UCI as like an internship thing. But nonetheless, gave me that patient hands-on experience that definitely helped me out as far as my resume. Um, but yeah, just going back to the extracurriculars. Yeah, do not underplay it. It's important. It's very important. Um, you don't have to do anything too crazy, but try to get some stuff on your resume before you start applying. And if you go to the next slide, please. Okay, how to prepare. This is like a case by case scenario. Everyone studies differently. Everyone organizes things differently. But obviously, the first thing you need to do is take the MCAT. The second thing you need to do is then send your applications. So to prepare for the MCAT, my suggestion is buy UWorld, do it twice, all of it, and I think you'll be fine for the exam, for the MCAT at least. When I took the MCAT, I didn't use UWorld, and I think that was like a very, very, very big mistake on my part. I used like other programs and stuff, and I still did questions and stuff, but it wasn't to the level of UWorld. So UWorld is the way to go for the MCAT. And again, do all the questions, try to do it twice, because you will pick up on patterns within the UWorld questions that you will see similar patterns on the actual real MCAT. And from people I've talked to that have taken the MCAT twice, from not having done any UWorld to then doing UWorld and then taking the MCAT, they've jumped like anywhere between 5 to like 6 points. One guy I knew, he jumped 14 points. So it's probably the only way, and the only way you should study for the MCAT is UWorld. And then I guess for the application process, again, letters of rec, very important. The way I did it was I got one letter of rec from a doctor, one letter of rec from an extracurricular like supervisor. So places I volunteered at, I asked one of the managers to kind of write me one. And then the other one was from one of my UCI professors. Each school, depending on what school you apply to, has different requirements for the letters of rec. So you kind of just have to see what schools you're applying to. But for the ones I applied to, those 3 were sufficient. So it's really important to network with doctors too. The good thing is, in SoCal, we have a lot of good doctors, especially within like the Armenian community, and we have a good networking amongst them. So try to make your networks early on, because then even when you're in med school, you could probably even do an elective rotation with them as well, which is what I did, and it was definitely worth it. And then sending in the applications, and then you're just kind of waiting for the interviews. And for that part, it's very stressful because you are just kind of in a limbo. You never know when you're gonna get invited for an interview. You kind of can't really commit to anything either. Like you can't really commit to another job long term because you're not sure. So for the waiting process, I would recommend that you just kind of take care of yourself, try to work on yourself, and stay prepared, because you never know when you'll get an interview. Like I didn't get any interviews until like late March, which is like almost at the end of the interview cycle. But in the meantime, I was kind of just preparing for the worst, which is I don't get any interviews. And I did so by like doing New World and preparing myself to retake the MCAT just so I don't waste any more time. So depending on how well you do on your MCAT, you don't have to do that, but I'm always like, I always try to prepare for the worst, and that's what I did. So yeah, and then how to decide between like MD DO and what's the difference between MD and DO? I really don't like those questions because when you're looking at it from the outside in, it doesn't seem to be like it doesn't seem to be like or it seems like it's like a big deal that you're a DO or an MD. But in practice, when you're in the hospital, it does not matter one bit. I've worked with MD doctors, I've worked with DO doctors. Like no one really cares. As the fact that you're a medical student and the fact that you'll eventually become a doctor, no one's gonna care what's behind the back of your name. So kind of just go where you feel like you'll fit in well and you'll succeed. Because medical school is what you make it and not so much what school you go to. But just to give you like a difference between the two, the curriculum's kind of the same. You do 2 years of didactics for both MD and DO, and then you take your board exams at the end of your second year called the Step 1. For DO schools though, you are required to take the DO board exam as well, which is called the COMLEX one. Excuse me. So the STEP is actually optional for DO students, but the STEP is the MD board. But it's highly recommended that DO students take the Step 1 along with the COMLEX because it'll keep you it'll make you as competitive as a medical, like an MD student. Maybe by the time you guys get in, it's going to be one exam, which is kind of what they were talking about before I was going to take it. So we'll kind of see. But it's kind of like leaning towards that direction that they're just going to combine the exams. But it's essentially the same exam. You have to study for it the same. You're not studying for you're not technically studying for 2 tests. You're studying for 1 test because the subject matter is exactly the same. Granted, the DO one has like some osteopathic stuff, which I'll get into, but that stuff is not too hard at all. But as a DO, you're getting the same. You're getting medical education. You're learning about medicine. You're learning about pathophysiology. You're learning about everything you would in an MD school or an MD program. But on top of that, you get trained in something called osteopathic manipulative medicine, or OMM. And essentially what that is, it's like a hands-on approach to patient care. People like to describe it, it's kind of like a chiropractor. I don't really like that comparison because as soon as I bring up chiropractor, people think of like backpacking and stuff. It's much more advanced than that. We kind of use our hands to diagnose. That's like the thing that they tell us. And we could treat pretty much a bunch of different pathologies, mostly musculoskeletal stuff, but also we could treat headaches, we could treat like respiratory problems, lymphatic drainage problems, just a bunch of different stuff. We have a bunch of different techniques that we learn. And it's kind of like a more conservative type of treatment that some people like, some people still practice even after graduating. A lot of DOs don't really practice it, so it's just kind of like a tool you have in the back pocket you could try. I know for me, my family loves it when I come home and fix their back and stuff. So I kind of get practice when I go back to my to my family when I go visit them. So they all love it. They all line up to get some back adjustments and stuff. So it's not so bad. But yeah, that's pretty much it as far as like the difference between the two. And I guess I could talk a little bit about the philosophy differential as well. For MD, like you're kind of so for like MD, the philosophy is like um, you're focusing on diagnosis and treatment of like specific medical conditions. Use like conventional medical techniques like drugs, surgery, yada yada yada. Uh, the DO philosophy, and it's what they like to emphasize. It's we have like a more holistic approach, or which is like we're kind of emphasizing the importance of like treating the whole person rather than just the one symptom of the disease. Uh, that's like the idea behind it. I wouldn't say it's necessarily true because I think both, MD and DOs kind of have that approach from my experience of working with both. But that's like the cookie cutter answer I could give you as far as like the difference in philosophy between the two. Um, all right. So, what should one know throughout the medical school application process? Um, I guess my piece of advice for you is it's a long journey. It's very stressful. You have a lot of pressure on you, and you don't have answers immediately. There's no instant gratification. Um, but try to find stuff to do while you're in the application cycle that keeps you happy, keeps you focused. Take care of yourself because once you get into medical school, it's very hard for you to go and do stuff you like to do. So just try to enjoy your time. It's not a sprint, it's a marathon. And let me tell you, like these 3 years that I've been in medical school, it's flown by. I'm already starting to apply for my audition rotations, and I'm gonna be applying to residency in like 3-4 months. So it flew by. It flew by like crazy. Uh, and while I really had very very stressful times like during medical school, uh, I I'm glad I went through it, and I think everyone applying and getting in, you guys will appreciate it too. So that's my one piece of advice for the medical school process or application process. Just enjoy yourself, because it's going to be a long journey afterwards. And then let's go to the next slide. Perfect. So let's drink some water. So what does a day-to-day look like? So again, the first 2 years, you're kind of just doing what you've been doing your entire life, PowerPoints, studying for tests, and then on top of that, you learn medical skills as well. As a DO student, we had uh, we had medical skills to learn, so we learned like different types of medical techniques and stuff, like such as like auscultation techniques, doing a physical exam, writing a document, etc., etc. But we also learn like the osteopathic stuff as well. So that's like your first 2 years. Um, and your third and fourth year, you're essentially doing pure rotations. You're just working full time. Uh, my school, we do 4 weeks rotations. So we do 4 weeks of like pediatrics. We take the shelf exam, which is kind of like a mini board exam at the end of the rotation. And then we go on to the next specialty. And you have like 6 or 7 core specialties, and you have like a few elective specialties that you could choose to do. And then once you're done with that, you take your third year board exams, which is the step 2 and the complex 2. And I forgot to mention, but at the end of your second year, you take the step 1 or the complex 1 or both. Those aren't graded anymore. It's just pass or fail. So a lot of the emphasis now is on the step 2 and complex 2 because those are still scored, and those kind of will play a role in your residency applications. And I think we got another chat in the what were the prerequisites for obtaining judge up? I'm assuming you're talking about the behavioral clinic. For that, there wasn't really any prerequisites. I was just I kind of got that job through an internship because the internship I had to do for my degree. So they kind of just hooked me up to getting that job. So it wasn't really, I didn't really need to do too much of a prerequisite to get it. And then like, what productivity method do you think has helped you the most to optimize your learning time? Uh, the way I study, very simple. I do a bunch of questions and I do a lot of Anki cards. I don't know if any of you are familiar with Anki. If not, don't worry, you will be, because that is the bread and butter. That's the holy Bible of medical students. Anki, it's literally changed my I guess like my projection in med school. I went from really struggling to being very confident with my medical knowledge because of just doing Anki. And it's very Anki is just essentially like a very smart uh, tool. It's a flashcard. It's like an AI based flashcard system, and it's essentially just consistent repetition of doing flashcards, and it kind of tracks how well you're performing on each card. So we could go more into that maybe another time, but because it's a very big talking point. But yeah, that's like the gist of it. Let's see, another chat. So do I take notes or do I mostly create Anki flashcards? For me, note taking doesn't really help. Yeah, I know some people that's all they do and they succeed perfectly fine. Uh, I just use this. Excuse me. I just use this deck I found online called the Anking deck, and it pretty much has your first 2 years of medical school in one deck, and then there's also the third and fourth year deck as well. So some guy made like a 30,000 card deck for the first 2 years, and another 30,000 card deck for the third and fourth years. So I kind of just leech off that guy, and most people do the same. Um, and again, that's something we could talk about another time, just because there's so much you could talk about Anki. But yeah, that's how I study, just questions and Anki. What to expect going into medical school? Honestly, from my experience, uh, while it was definitely I had very stressful times. Uh, I honestly had a pretty chill experience. I thought it was going to be a lot more intense, but honestly, it's pretty laid back. I don't know if that's just my school, um, or it's just like I don't know my personality or the people I was with, but it's a lot more chill than I thought. It's not as scary as you think going into it. So hopefully that kind of helps you stay calm about that. And I guess recommendations for a future medical student, um, just be confident in yourself. If you really want something, you can do it. I know like when it comes to like being a DO, there's this like stigma that DOs don't get good residencies anymore and whatever. I don't think that's true. I know many DOs that got very competitive residency matches, like interventional radiology, orthopedic surgery. So it's kind of what you make of it. Um, don't let anyone tell you just because you're a DO or something, or even as an MD, if you're not performing well, don't let anyone tell you you can't do something that you really want. So medical school is what you make it. If you really want something, if you really want that competitive specialty, that competitive residency program, uh, you can go get it. Yes, it's a lot more work, but if you really want it, that work is not going to matter. It's not going to change your, I guess, approach to it. So I guess that's my piece of advice. I guess now we have like a little bit of Q&A. Also, I left my email address, LinkedIn, Instagram. If you guys have any more questions, you guys can feel free to reach out to me. I'm an open canvas. I'm more than happy to answer any questions anytime. So I left that information in the PowerPoint. And if you have any more questions, this is the time to ask them.
I think there's one in the chat. It says, how does the interview process vary between the MD and DO schools?
Okay. I guess I forgot to talk about that. I think the interview process varies from school to school. Some schools use forget what it's called, but it's like multiple mini interview process, or it's like you do like 12 or 13 different like mini interviews. Uh, it's kind of like speed dating almost. That's how most people have described it to me. I didn't actually get to do any of that type of interviewing, so I don't know. I'm not too familiar with it. But from my understanding, it's you get like 2 minutes with one of the academic professors or whatever. They ask you like some random question. You have to answer within 2 minutes, and then you go to the next person. And then there's like team building stuff as well. So it's a little complex. I'm not too familiar with it, but it's like speed dating. And then you have your just traditional interviews. From my experience, they asked me a lot about me and not like my grades, and like they've asked me more of like what I've done and why I did things, why I chose their program. So you got to kind of do a little bit of research before going in. Excuse me. Let's see. I talked about random things too. Like I had 3 interviews in one day, and I had one 15-minute interview where the guy kind of just talked to me about traffic in Los Angeles. So I guess he was just trying to see how well I was able to conversate with him and socialize. I don't know. So it's kind of just depends who you have interviewing you. So nothing too crazy. Um, we got another question. Does the application vary in any way between MDDO schools? Is it the same number of activities and same personal statement format? Uh, I think it's very similar. There's probably very minute, different, or I guess like there's maybe some different things, but more or less very similar. Again, some schools may require 4 letters of rec. Some schools only require 3. Um, the personal statement is usually like, what's your story? And I forgot to talk about this, but for your personal statements, uh, try to make it unique. Try to find something in your life, or something that happened to you, a funny story, whatever, to talk about in your personal statement. Because like applying to medical school, they already know you want to help people, so kind of bringing that up and not really giving them like a story to make you interesting or stand out is not gonna help you out at all. Like my personal statement was me talking about me being a mechanic, which I was working with my dad for before choosing to go into medicine, and I talked about how like working on cars, diagnosing what's wrong with the car, and then fixing the problem is like being a doctor or being a surgeon or something. And they love that. That's all they talked about in my interviews as well. Um, so find something unique about you, find a unique story, talk about and write about it. And then just make like keep editing it and making sure it sounds good. And yeah, just don't say like, yeah, I want to help people and that's it. Find an interesting story to talk about. It could be about anything. And the more random it is, and the more you're able to like kind of correlate that to like the medical field, the better it is for you, I think. But don't write something too weird. But like, you know what I mean? Try to correlate it to medicine somehow, but try to make it a little interesting. Spice it up a little bit. Let's see. Do you need a DO letter of rec when applying to DO schools? It helps out, but it's not necessary. How many hours a day do you spend studying? Uh, so my first 2 years, uh, we had lecture all day, and then we come home and we have to study. So I would say maybe like 8 hours of class, and then maybe like another 3, 4 hours, 5 hours of studying afterwards. In my third and fourth year, you work full time essentially, so you don't have that much time to study. But honestly, studying for it is a lot more like it's not as intense as it was in my first 2 years. It's a lot more chill because the content is more clinical based stuff, which is more interesting to me instead of like learning about histology, which if you don't know what that is, it's just like looking at microscope slides on a microscope, which unfortunately is for some reason it's very important to know for your step one board exam. But I don't know, my third and fourth year studying, I only study when I come home from my rotation, I only study like maybe 2 to 3 hours and then I hang out and I go to bed. So it's not as intense. Let's see. Is there one experience in particular that helped you determine that you for sure want to pursue medicine? That's a good question. I guess like going back to me being like working with my dad at his mechanic shop, I kind of just wasn't being fulfilled. Cars they don't display emotion. They don't have any gratitude when you fix them. So it wasn't as fulfilling as I'd like. So that's kind of like pushed me towards medicine. Also, I like being at the hospital for some weird reason. I don't know why. I just enjoy being at the hospital. So that was like another factor why I wanted to pursue medicine. So yeah. And are you able to manage your time to fit in things you enjoy on a day-to-day basis? My first year, yes. My second year, no. Just because the step one and the complex one are such big exams. And that's probably going to be the hardest test in medical school is those two, or the step one is probably going to be the hardest test in medical school throughout medical school. So I felt like in my second year, I kind of was more of like a hermit. I didn't really go out too much. I didn't hang out too much, and I was studying a lot more. But my third year, definitely, I have a lot more free time. I don't study as much on the weekends, and I'm doing just fine. I get to do what I want. I get to go work out comfortably. I get to go watch soccer at the pub, which I love doing. So yeah, it gets better as you go through medical school. Your second year is just going to be your worst year, and then third and fourth year are just going to get better and better. What was my major for undergrad? I was a public health science BS.
I have a question. Oh, sorry.
Go ahead.
Interview process. Like, how are you able to, was it like a skill that you trained yourself to answer these questions? Like, what was the process of that going into interviews?
Could you repeat that? Sorry, kind of cut out.
Yeah, my question is essentially like, how did you prepare for the interviews? Like, was it a skill yourself? Like, what did you do?
Yeah. So the best way to prepare, there's like stuff you could look up online that I guess like people have compiled like a list of questions they got asked. And what you can do is like print out those questions, give it to like a family member or friend or someone else, like one of your friends that are applying to medical school, and you guys can kind of just interview each other and kind of hone your answers accordingly. And they don't really like stray too far from what I've seen. They don't really stray too far from that question sets that I found online. It's kind of very similar stuff. Once in a while, you'll get that weird question, and you just got to kind of wing it. So yeah, just practice makes perfect, I guess, for interviewing.
There was a question in the chat. What were you looking to specialize in?
Oh yeah. So I like physical medicine and rehab, or PM&R. It's still like a very small field, but I like my favorite organ system is musculoskeletal. So I like doing knee injections and stuff. So that's kind of what I'm leaning towards. And as a DO, actually, they like DOs in that field, so it's a very DO friendly specialty as well. Because just because we get so many hands-on hours with touching other people as far as doing our techniques and stuff. We have a good feel for like MSK anatomy. So yeah, that's kind of what I'm leaning towards, or internal medicine. Do we have any other questions?
There's a longer one in the chat. It was, what rotations do you rotate through in medical school, and is there an option to rotate through a specialty of your choice?
So the rotation, the core rotations are kind of dependent on your school, but usually it's most likely you're gonna see a pattern of internal medicine, surgery, family medicine, psychiatry, OBGYN, and then I'm missing one. I feel like I'm missing one. Family medicine, internal medicine, surgery, OBGYN, psychiatry, and I think that's it.
Peds.
Peds, there we go. I knew I was forgetting one. Peds. And then is there an option to rotate through a specialty of your choice? Yeah, usually you get like a couple elective rotations where you could pick and choose what rotation you want to like rotate at. And that's totally up to you. Least favorite rotation, definitely OBGYN. Even though I did pretty well in it, it was too much stress for me. I'm way more laid back. I'm a very laid back person, and OBGYN, you have to have a special kind of personality, and I don't have that personality or the patience. But hey, I delivered 4 babies, so I'll take it. My friend Serge, actually in chat, he wants to do OBGYN. So if you like that type of stuff, you should reach out to him. He's a little shy though. Do we have any more questions? Or is that it? I think that may be it. So yeah, if you guys if you have any more questions or anything, I did leave my email, LinkedIn and Instagram in the chat or in the PowerPoint. So I don't know if we could still have that up just so people could write it down. You guys could reach out to me anytime. I'm an open book. I'll answer any question anytime. Doesn't matter if it's 3 a.m. I'll get back to you. So, and also we do run a program called Rise and Raise where we pair you with a medical student as a pre-med. So check that out. It's called Rise and Raise. We're on Instagram, and Sophia could vouch for it as well. There you go.
Is there any
Alrighty.
last minute questions? Oh,
Were you saying Rise and Raise?
Yeah, and it's in the chat too. Rise and Raise, you can find them on Instagram, and it's like a mentorship program. We pair you with a medical student, and you kind of have a person going through it, kind of have you like have a one-on-one mentor. We've had some really good success stories as far as applications go. So check it out. We have a lot of good mentors. We try to pair you with someone in a similar situation as you. And we have mentors all over the country as well. So very vast, different experiences. So check it out.
okay.
That's it. Alrighty. Thank you so much. I had fun. And again, feel free to reach out to me anytime.
Thank you. That was so
you.
informative.
Thank you.
Thanks, guys.
Thank you.
You.
Thank you. Get on Discord, yeah.
Okay.
Thank you so much. Oh, let me stop.
Thanks.